I'm Dr. Crystal Brimer. I own a private practice in Wilmington, North Carolina, and 90% of what I do there is dry eye. It starts with the patient bringing in an extensive questionnaire that I've created, and this questionnaire nearly eliminates the need for an in-office history. This is key in controlling the time allotted for my dry eye eval. Ultimately, my goal is to assess the patient's level of water, oil, allergies, inflammation, bacteria, lid function, systemic, environmental conditions. And more importantly, I need that patient to be able to visualize this and understand all these elements so that he or she is compliant with my recommended treatments. For this reason, the vast majority of my exam is done with the 5M. We perform tear meniscus height to assess the water component, a non-invasive tear breakup time and interferometry to assess the oil, tear film dynamic to assess the tear quality, and bulbar redness to assess its effect on the surface and any secondary inflammation. Topography for any corneal dystrophy or degeneration, and then we collect extensive images and videos with lysamine green and fluorescein dyes. I finish with my biography. And at this point, the only thing left to do in my exam is debridement of the lid margin and expression, and I do that at the slit lamp. Once the process is completed though, I rank my contributing issues according to their severity, and then I check the boxes as to what treatments I want for that patient. And then comes the most important part of all. I pull up my 9-picture collage on the 5M, and this allows me to walk the patient through her story. I remind her of our goal for the day. It's to break down the underlying causes to her symptoms, and then I show her the water, the oil, the lack of color in the tear film, the quick breakup time, the partial blinks, her meibography, the debris in the tears, the redness, the staining. I equate each of these to the categories we discussed at the beginning, and then as we walk through it, I describe the treatment we're going to do for each one. The patient leaves with a palpable hope for relief, a better understanding, and a drive to be compliant. And compliance is what creates the outcomes. The outcomes generate the referrals, the practice growth, and the revenue.